Good morning, everybody. We are headed into fall and it's time for our latest COVID report. So let me start sharing my screen with you. And I'll just start with our overview as usual. You can see that overall we're looking pretty good, that global cases continue to decrease. Hotspots really remain the same, and cases and hospitalizations continue to decrease in the US and California. Mortality is continuing to decrease in the US and is pretty stable in California. So to start with vaccination, you can see here that the US continues to sort of hang out around this mid 50% of our entire population fully vaccinated. And that remains the lowest among other Western democracies. And you can see that China is starting to move up in their percentage of their total population that is fully vaccinated at this point. You can see that close to 190 million people in the US are fully vaccinated, and 10.9 million have received a booster dose. And when you come over here and look at these age breakdowns, you can see that we are actually now doing quite well in the age group over 65. Almost 96% of the population in that age group is fully vaccinated, and actually doing quite well, close to 80% in the age group over 18. When you look at administered doses, you can see that we're averaging about 0.84 million per day at this point. And when you look at the prediction of what that means as far as when we'll get the majority of our population vaccinated, right now 85% vaccinated at the end of June is what we're predicting. You can see when you break it down by state that unfortunately these three states, Idaho, Wyoming, and West Virginia, really have not moved significantly over the last 2 weeks, or even before that. You can see they're hanging out right around the 44 or less percent of their residents fully vaccinated. But when you look at Mississippi and Alabama, you can see they finally have had a significant increase in the last 2 weeks. So that is good news. And when you look at California, you can see we're pretty stable as far as how many doses we're administering over a 7-day moving average, right around 0.96 million right now. When you break this down by age group, you see something interesting starting to emerge that I haven't told you about in the past. Over the last few months, we have really done quite well in reflection with the rest of the US and outpaced the rest of the US in vaccination. But now you can see that in overall age group over age 12, California has slipped a little bit in comparison to the rest of the US. We're just around 72% with the rest of the US at 77. And in the elderly patient population or population overall, California is now down quite a ways compared to the overall US population. And so this is maybe some place that we need to focus on. You can see this actually reflected in Santa Clara County, where when you look at the overall population vaccinated, over 85%, 86% vaccinated, and that looks really good. But when you break it down by the age over 65 category, you can see that although we're still in the 80s, and that is good compared to the rest of California, we actually are now again slipping in comparison to the rest of the United States. So perhaps an area we need to focus on here as well. When you look at overall cases globally, the cases continue to rise, but not at the same rate as before in the recent months, and fatality remains low. When you look at overall this chart, you can see there's been an 8% drop over the last 2 weeks, which is still coming down, but just not at the same rapid rate as the few weeks before that. And this map really has not significantly changed overall. The hotspots that were there a couple weeks ago remain hotspots, but there are no new blooms in any of these countries. When you look at this map, this is an interesting finding to me, where the countries that we had been monitoring closely before with spiking case rates, such as Cuba and Israel, have come down nicely along with the US coming down. But the UK now is sort of spiking at a rate that we have not seen until recently. And there are many different theories as to why this may be. We'll talk about that in a little bit when we start talking about new variants. So when you look at our cases nationally, you can see that these continue to come down overall. And when you look at the sort of breakdown by region, you can see that there is this persistence in the northern states, certainly in Alaska, although their case rates are coming down slowly in recent days. And then again, of course, kind of centered around West Virginia over here, and that reflects their sort of dismal vaccination rate. When you look at these states by states breakdown, you can see that Vermont and New Hampshire are still actually rising in their Delta surge, but the rest of these states are either stable or coming down. And when you look at cases in California, you can see that they continue to decrease as well. Santa Clara County, thankfully, also continues to decrease, and San Mateo County also continues to decrease. When you look at Stanford cases, you can see we're actually doing very well. Remember the blue bar is overall cases tested, and then the red number is actually positive cases. So only 2 positive cases in the last week, even though we tested 15,000 students. And when you look at faculty, postdocs, and staff, only 3 cases in the last week, even though we tested over 10,000 staff and faculty. When we think about variants, Delta variant remains the variant du jour and of the week and of the months preceding. Really no changes there in the US. When you look at California, similarly, close to 99% is the original Delta variant, and then just under 1% within the other Delta plus variants, and really nothing to speak of in the other categories. However, if many of you have seen in the news recently, and harking back to that UK spike I was showing you, there is a new Delta variant. This is called AY.4.2. And when you look at this little graph down below, you can see this small sliver of yellow starting to appear at the end of July. And since that time, it has started to grow in the sort of percentage of overall cases that it is taking up. At this point in time, it's about 8% of all cases in the UK. And some people think that this may explain why there has been this recent spike in cases overall in the UK. However, when you look at the AY.4 variant in the United States, you can see that actually it peaked at about 14% of all of our cases back in September. And since then, it's really come down to about 7% currently. So it does not appear to have outperformed the original Delta variant in the US, at least up until this point. When we think about why else the UK may have cases spiking, there are other things to consider. Their overall case rates are rising most rapidly in school-aged children. And when you think about the percentage of the children between 12 and 15 that are vaccinated, it's actually quite low. It's less than 8% in the UK right now. And so that may have something to do with it. It's also true that the UK started vaccination much earlier than the rest of Western Europe and US. And so perhaps they've just had waning of their immunity happen more recently and more robustly than the rest of these nations. And it is also true that there is a heavier reliance on the AstraZeneca vaccine, which has shown to not have as long-lasting or robust immunity as Pfizer and Moderna, which was the majority of the vaccination that took place in the US. So all of these factors may be things to explain this, but I do think that we should just keep an eye on this AY.4.2 variant and see what happens with that. When you look at Santa Clara County, you can see that overall Delta and Delta Plus continues to be the majority of our cases. We continue to have a few of these Mu and Lambda cases that we mentioned before, but nothing taking a major share other than Delta. When we look at COVID-19 in the pediatric patient population, this was a little surprising to me that although overall cases and hospitalizations are coming down across the country, when you look specifically at the pediatric patient population, you can see that over the last 2 weeks, children represented 25.5% of weekly reported cases. And that is, again, a 5% increase in cumulated number of child cases. And this is, compared to, if you recall, prior to August, only 14.6% of children. So the share of COVID in children continues to increase, even though the overall case rate continues to come down. Thankfully, when we look at hospitalizations and mortality, these are quite low and continue to remain low. Looking at overall hospitalizations in the US, thankfully, this continues to decrease nicely. And when we look at hospitalizations in California, you can see that this overall number continues to decrease and ICU hospitalizations continue to decrease. When you look at overall hospitalizations by age breakdown, interestingly, you can see overall all of them have decreased. However, in this age 70 and above, there has been this recent uptick in cases at this tail end of the graph. So certainly something to keep an eye on and maybe reflective of the fact that we're not doing as well anymore in the vaccination rates in this elderly patient population. You can see this reflected in Santa Clara hospitalizations. It was decreasing and now a slight uptick. San Mateo hospitalizations, you can see again, there's this slight rise at the end of this bar graph over here. Thankfully, San Francisco in the city does continue to decrease. And when we look overall at the Bay Area, we do have an overall decrease. However, just in the last day or so, you can see there's a slight uptick in cases. This may be simply reflective of a reporting anomaly, and we'll have to just keep an eye on that. When you look at mortality overall nationally, there has been a steady decrease, just a slight uptick in recent days, again, perhaps just reporting. When you look at cumulative deaths, unfortunately, the US continues to have a higher number of deaths compared to all other first world Western democracies, and even higher number of cumulative deaths than places like India. When you look at California, you can see that we did come down, but now are sort of just stable and kind of jaggedly going up and down a bit as far as our mortality rates. And when you look at Santa Clara, thankfully, this has been coming down in our county here. And when you look overall at California, comparing the number of cases and the number of deaths compared to vaccination status, you can see that overall Californians are 7 times more likely to get COVID-19 if they are not vaccinated compared to vaccinated people, and overall 18.7 times more likely to die of COVID-19 if they are not vaccinated versus fully vaccinated people. So just again, a reason to encourage vaccination, especially in that elderly patient population and younger patient population once they are eligible. And that's the report for now. I hope that helps all of you make decisions for your family and your friends, and I hope all of you stay safe. And I'll see you in a couple weeks again.